Over the last few years, there have been a few epidemics around. There's been H1N1 influenza, the pandemic that was supposed to happen, and there was SARS. Remember SARS? Well, we wondered where all those epidemics have actually gone. And to find out, we spoke to a world authority on new and emerging diseases, Professor Stephen Morse.
We think of 1918, of course, as the greatest natural disaster possibly in all recorded history. In terms of 50 or 100 million deaths over a period of a year or two is phenomenal. And, you know, when you think about that, it's because almost everybody in the world, essentially 40 or 50% of the world's population was infected. The effects were dramatic, especially in young, healthy adults, which is what raised the red flags with HIV and with SARS and some of the others as well, that it would kill young, healthy adults. We can't be complacent because those infectious diseases remain part of our existence and remain part of our world. And of course, many of them since then, we've had SARS, we've had an influenza pandemic, and we worry about others. We've had the H5N1 influenza. We've had Nipah virus in pigs and also infecting humans and a number of other species in Malaysia, and then some cases in Singapore related to abattoirs. In Australia, there was the closely related Hendra virus, which killed several horses and a horse trainer, and some other individuals became very sick with it. And we have no shortage now of emerging infections, SARS probably being one of the more dramatic, but of course we still continue to worry about influenza pandemics. I personally think with H1N1, we were very lucky. So I think we've seen many infections emerge in recent years, and of course I'm concerned that there are many still out there that we don't even know about yet, as in the case of SARS, which we didn't know about until suddenly it emerged in 2003.
So Stephen, one of the questions people have is, where are they now? I mean, let's take SARS for example. Where is it now? Are there any cases at the moment? SARS
is a very interesting example. We haven't found, as far as I know, there are no natural cases that have occurred in Asia or elsewhere. There was a laboratory accident a few years ago. It's sort of at the tail end of the SARS epidemic. And so that possibility, of course, can't be ruled out. So I think there's still a lot about the transmission of SARS that we don't understand well. But I think it died out largely because of very assiduous control efforts, especially in the hospitals with infection control, very careful infection control. So the virus is still out there, and whether it could be reintroduced, for example, and reemerge, I think is a real possibility. We just don't know, and we don't know how to assess that risk, but certainly the conditions still exist.
But if it's still out there, the same virus is still out there?
I think the virus that gave rise to SARS is still out there. Whether it would require another mutation, another evolutionary event to be able to reinfect humans from that bat reservoir is uncertain. So what's to stop bats becoming the 747 of disease and spreading more widely? Well, I think bats do have a number of infections that we're beginning to learn about, some of which do have the potential, obviously, to cause human disease. And many bats, there are a number of fruit bats, for example, that have a fairly wide range and do, in fact, go over long distances. And one of the interesting questions is why we don't see human outbreaks or even outbreaks in agricultural settings occurring more often. That gives me a little hope, at least, that this is a problem that we can deal with through good surveillance and early warning and appropriate control measures. But I think it's important not to vilify the bats, not to blame the bats for the infections that they carry. Just as we carry our own microbial flora, so do they. And it's just accidental that we might come in contact through an agricultural setting or a live animal market or some other interface and become infected. Obviously, luckily for us, that's a rare event and continues to be a rare event.
Where's H1N1 now, this virus, the influenza virus that we were so scared of last year?
Yeah, I think that's a very interesting question, and I think we're still asking ourselves that question. Clearly, H1N1 was a much milder pandemic than we had initially perhaps thought the next pandemic would be. But it would be a relief if they were all as relatively mild as H1N1. There were, tragically, people who died, especially, in certain groups, pregnant women, people who were obese, and a number of others who had no underlying health problems, others who did have underlying health problems, of all ages. As with all pandemics, we saw deaths across the age spectrum. Unlike 1918, you didn't see the same number of deaths, thankfully, in young, healthy adults. That's really one of the things that made 1918 unique.
So has it just died out? I mean, where is it?
Well, we still do see cases of infection with H1N1. What's been typical of many pandemics in the past is that an influenza virus will circulate, a pandemic will occur, and essentially it'll wipe the slate clean and establish itself as the new influenza virus. As it mutates and evolves, it becomes the predominant seasonal influenza virus. But the so-called seasonal influenza virus, the annual or biennial epidemics that we see, are really the progeny of the pandemic virus. H1N1, the first of the 21st century. There will be others.